Welcome everyone to this series of videos where I will be talking about an important subject that touches on lots of people's lives and livelihoods, that is having a new approach to making residential developments and apartment buildings healthy forms of housing for people and the environment where we live in. I'm Dr. Al-Obaidi. I have a PhD in healthy places and housing, where I examined what makes apartment buildings healthy. And my research was about asking residents themselves about what influences their health in relation to apartment buildings from their perspectives and using their lived experiences. So what is this series about? In the following 5 videos, I will provide a series of short educational videos on making future apartment developments healthier for people and the environment. And who are these videos for? They concern those involved in decision-making, policy-making, design, planning, and project management of future apartment buildings and residential developments, but it could be of interest to the general public if you're a resident living in an apartment building, somebody who's from the community, and so on. Throughout the series, I will be using actual examples from residents who live in apartment buildings in the city of Sydney in Australia, who I interviewed during my PhD research, but the videos are relevant for national and international audience because all cities, as we all know, local areas, suburbs are building up, so they're building vertically and they're going high density. And if you need more information, I listed here some key references on this slide, which you can refer to in addition to this video, including my own PhD thesis at the top, and also recent articles that I authored or co-authored on the subject. So why apartment buildings and why apartment living? Let's take the case of Australia. Urban developments have, in general, been directly linked with the compact city planning model, which got adapted in Australia. The model is characterized by having higher people and development densities. Usually these are concentrated around transit hubs, business hubs, and transport hubs. And according to the most available data from the official government of Australia, which is the Australian Bureau of Statistics, within a period of 15 years between 2004 and 2019, apartment commencements in Australia was risen by almost 82%, as shown in the figure that you could see on the slide. Most of those developments were dominated by buildings, which you can consider as 4 stories and above, and that also illustrates a decrease in low-rise dwellers, those less than 4 stories in height. And also the other trend that showed us is that Sydney was having one of the highest proportions of apartment dwellings in Australia. And this trajectory is also set to increase around the world and in Australia as well. And I suspect new statistics from Australia, which hopefully are coming up right now, might show the same trend as well. Now, internationally, what about internationally? I found a recent research study that was published by Nature Cities by authors Frocking and their colleagues, which concluded that cities worldwide have transitioned from horizontal expansion, that is spreading out, to more of vertical development, that is building up. Over the past 3 decades. So they noticed that, and I've included a screenshot and I copy-pasted that onto the slide so you can have a look at that study. So before we start, it's important to really know and understand what we mean by health and well-being in the context of apartment living. So health here means it's not just an outcome. So don't just think about health as just, diabetes or stress, etc. or obesity, and so on. We need to think about health over the life course of a person. Health adapts, it changes. And that happens from before we're born all the way to, when we die. And think about health in terms of physical as well as mental. So both health because both of them are interlinked, both of them really sit within our body, so we can't separate both. And also think about health as it links and as it is dependent on the natural environment where we live. And that natural environment involves biodiversity, the climate where we live, the resources that we have, and so on. So they're both interlinked. They depend on each other. And we are dependent on the health of the environment itself. In terms of now well-being is an interesting one. It's usually a term from my own research about the term. I found it to be a term that is always used with health. The usefulness of it, and there has been a lot of research on the topic, is that it brings attention to people's feelings, passions, their subjective views, so what they think about life, their aspirations, and it also the word well-being. The benefit of it is that it brings also a non-medical dimension to health, to signal that we're not just talking about clinical health in here or medical aspects of the body or the mind, but we're also thinking about what people think and what do they want in life, and so on. Another important point that is worth explaining is that although most of apartment developments are happening in cities, we shouldn't just think about cities as a rigid boundary, because there is no rigid boundaries there. Health and well-being are not contained or determined by borders. The drivers of health and well-being can be non-urban and equally influence city residents. That's one point. The other angle is that apartment buildings can be built in regional areas, rural areas, or just outside administrative city boundaries. And in this case, we will need to think about new developments within the context of those areas as well. So why care about making apartment living healthy? Well, the first one, which I already touched on, is that apartment building development is set to continue, as we could see from the trends, unless something major happens and then there is a stop. But it's very known that apartment living will always be there and has existed for a long time. It is costly to live in unhealthy places, and that cost could be in social terms. It could be from an employment point of view. It could be from a healthcare point of view, and so on. If unhealthy, people won't continue to live in buildings. And one example I could give you is COVID-19 pandemic, where people had to rethink about where they are living, whether, for example, they have a garden, whether they have space, whether the apartment itself is catering for their needs. And maybe it did. Some people thought about resizing and going for an apartment living because they could, talk to their neighbors and so on. It is common sense for developers and governments really to ensure that apartment buildings are healthy. And that links to reputation in the case of developers, and also it links with elections. So, for example, one resident that I've interviewed, who lived in an apartment building, he made it very clear that if a politician comes in today, and they talk about and they make pledge to look at apartment buildings in a new way, and to make apartment buildings better quality, etc., that could be an election deal breaker as well. And also unsustainable, having unhealthy apartment living could be unsustainable and a planet damaging, if not carefully considered, and that could come in so many different ways, including through resource uses, including through apartment buildings becoming unsustainable in the long term, people abandoning them basically because they don't fulfill their needs, and so on. And also other types in terms of the water usage, all these kind of things. And critically, people want and they deserve better housing. So as practitioners, we have a duty of care regarding what we approve, build, legislate, plan, design, engineer, assess, and quality control. We need to think about the value of what we are building and make that center of mind. So the next set of videos that follow will provide a framework of components which together need to be considered by those involved in future developments if we want to create healthy apartment living. And I will be using examples from, as I mentioned, from lived experience of residents from Sydney in Australia to demonstrate each component. And here I listed the 5 fundamentals for creating healthy apartment buildings and residential developments. You should consider these 5 components together. That is really important, as these are really related to each other. They are interlinked. And importantly, this framework isn't just a checklist. It changes how you, whether you are a manager, practitioner, strategist, counselor, researcher, policymaker, contractor, etc. It changes, how you think about planning, designing, strategizing, and doing policies concerning healthy apartment development. You could see here, I'm not providing a list of factors or variables that you can just typically, that can typically can be ticked in your project or policy. I'm moving things up a layer and up a level to make you shift the way that you think about creating healthier housing and places for people. And in the next set of videos, I will go through each component in detail. My hope is that after watching the videos, you will have a complete shift in the way that you think about how you can create healthy residential developments.